Hello, we are looking at origins and insertions on the tibia. So here we have a left tibia. We can indicate or orient this based off the medial malleolus here of the tibia. So we're going to start with originations. So originating on the superior half of the lateral surface of the tibia, as well as on that lateral condyle, we have the tibialis anterior muscle originating. If we rotate and look at the posterior side, here on the tibial soleal line originating, we have the soleus muscle originating here. Inferolateral to that soleal line originating, as well as on the lateral surface of the tibia, we have the tibialis posterior muscle originating. And then if we kind of go down, so on the medial edge of the posterior diaphysis of the tibia, we have the flexor digitorum longus originating here. And then if we kind of rotate, so now we're looking up at the lateral condyle of the tibia, we have two muscles originating here. So the superior muscle originating on that lateral condyle of the tibia is the peroneus longus muscle. And then inferior and a smidge anterior to that, also originating on the lateral condyle, we have the extensor digitorum longus muscle originating there. Now looking at insertions, so we're going to start here on the superior medial portion. Superior medial portion of the tibia, originating on that, inserting on that tibial tuberosity, we have the vastus medialis muscle inserting here. Moving down inferior on the pes anserinus, we have three muscles inserting here. So all three of those muscles will start medially to laterally. So inserting on that pes anserinus, we have the sartorius muscle inserting there. Lateral to that, also inserting on the pes anserinus, we have the gracilis muscle inserting here. And then lateral to that as well, inserting on that pes anserinus, we have the semitendinosus muscle inserting here. Then if we move to the, medial condyle, inserting on that posterior portion of the medial condyle, we have the semimembranosus muscle inserting here. And then on that posterior side, superior posterior side portion of the tibia, inserting here, so this is along that tibial soleal line as well, inserting, but it appears to be just a smidge medial, but inserting on that tibial soleal line, we have the popliteus muscle inserting here, and then one additional muscle inserting on the tibia. So this is, on the superior lateral side, on the Gerdy's tubercle of the lateral condyle of the tibia, we have the iliotibial tract inserting here. Let's make sure I got them all. Hello, we are doing origins and insertions of the femur. Here we have a left femur. Looking at it from an anterior view, we can see the lesser trochanter pointing medially helps me orient that to know it's a left femur. So originating on the anterior surface of the femur, we have the vastus intermedius muscle originating. If we rotate a little laterally, originating on the greater trochanter down the linea aspera and lateral diaphysis of the femur, we have the vastus lateralis muscle originating. Rotate posteriorly, originating here along the linea aspera and lateral supracondylar line of the femur, we have the short head of the biceps femoris originating there. And if we rotate to the medial side, originating along the linea aspera and the medial diaphysis of the femur, we have the vastus medialis muscle originating. And then looking at the posterior side down here on the proximal end, originating on the popliteal surface superior to the medial condyle, we have the medial head of the gastrocnemius originating. And then on the lateral side, originating on the inferior lateral supracondylar line, we have the plantaris muscle originating here. And then moving to the lateral side as well, here on the lateral aspect of the lateral condyle, we have the lateral head of the gastrocnemius originating, and then inferior to that, on the lateral epicondyle of the femur, we have the popliteus muscle originating here. Now looking at insertions. So here, back to the proximal end, on the anterior surface of the greater trochanter inserting, we have the gluteus minimus muscle. So that's on the anterior greater trochanter, gluteus minimus. And then if we rotate to the lateral side, so here on the anterior lateral greater trochanter or surface of the greater trochanter, we have the gluteus medius there on that anterior lateral surface of the greater trochanter. So gluteus medius inserting here. And then on the superior aspect of the greater trochanter inserting here, we have the piriformis muscle inserting. And then if we go medial to that greater trochanter here, we have the trochanteric fossa right here. And inserting there is going to be the obturator externus muscle inserting. Okay, looking at the posterior side. So here on the femoral quadrate tubercle of the inner trochanteric crest, we have the quadratus femoris muscle inserting here. And then on that lesser trochanter of the femur, we have the iliacus and psoas major muscles inserting here. And then inserting on the gluteal tuberosity of the femur, we have the gluteus maximus muscle inserting. Medial to that, so inserting along the linea aspera all the way down the linea aspera. So inserting down the linea aspera to the medial supracondylar ridge of the femur and adductor tubercle, we have the adductor magnus muscle. So that's inserting down the linea aspera to the medial supracondylar ridge and adductor tubercle. Again, that's the adductor magnus. Medial to that, so this is inserting, let's see, on the superior linea aspera and inferior pectineal line. Inserting right there is going to be the adductor brevis. So again, that's the superior linea aspera and inferior pectineal line, adductor brevis inserting. And then inserting on the pectineal line, we have the pectineus muscle, if you can see. Again, on that pectineal line, that's the pectineus muscle inserting there. And then on the central linea aspera, inserting down here, that is going to be the adductor longus. So again, that's the central linea aspera, and the adductor longus is going to insert there. Thank you. Hello, we are looking at the hip bone. We're going to be doing origins on the hip bone. So we are looking at the right side of the hip bone. We can indicate this just by answering that telephone. So starting with origins, we're going to move to the lateral side. So originating between the posterior gluteal line and anterior gluteal line, originating here, we have the gluteus medius muscle originating, and then originating between the anterior gluteal line and inferior gluteal line, we have the gluteus minimus muscle originating. Then originating on the anterior superior iliac spine, as well as inferior to the iliac crest, originating here, we have the tensor fasciae latae muscle originating. Also originating on that anterior superior iliac spine, we have the sartorius muscle originating. Inferior to that, originating on the anterior inferior iliac spine, as well as on the painted bone, it appears on the superior rim of the acetabulum, we have the rectus femoris muscle originating. And then if we move back to the posterior aspect, originating on the posterior ilium to the posterior gluteal line, we have the gluteus maximus muscle originating. And then kind of near the posterior inferior iliac spine, originating on the sacrotuberous ligament, we have the piriformis muscle originating here. And if we move inferiorly, originating on the ischial spine, we have the gemellus superior muscle. Inferior and a smidge medial to that, originating on the ischial tuberosity, we have the gemellus inferior muscle originating. Back to that anterior view, originating on the ischial tuberosity, we have the semimembranosus muscle originating here. Also originating on the ischial tuberosity, we have the semitendinosus muscle, as well as the biceps femoris long head muscles originating here. Inferior to that, originating on the inferior pubic ramus to the ischial tuberosity, we have the adductor magnus muscle originating here. superior to that, originating on the lateral ischial tuberosity, we have the quadratus femoris muscle originating here. And then originating on the external rim of the obturator foramen, we have the obturator externus muscle originating here. And then moving superiorly, originating on the pectineal line of the superior pubic ramus, we have the pectineus muscle originating. If we move inferior, originating on the inferior anterior pubic body, originating here, we have the adductor longus muscle originating. If we move inferior to that, on the inferior pubic body and inferior pubic ramus originating here, we have the adductor brevis muscle originating. Inferior to that, also originating on the inferior pubic body and inferior pubic ramus, we have the gracilis muscle originating. And then if we move to the medial side of the hip bone here on the superior region, originating on the iliac crest and iliac fossa, we have the iliacus muscle originating. And originating on the internal rim of the obturator foramen here, we have the obturator internus muscle originating. And then if we move to the posterior aspect, so originating on the posterior iliac crest, kind of on the medial side, originating here, we have the erector spinae muscles.